Hello, this is Dr. Burak Ersen. Today we just finished the first surgery of 2025. It was naturally a BBL surgery. My patient arrived Turkey 2 days ago and we direct transferred her to your hotel room. She rested in her first day. Yesterday we completed her anesthesiology examination and we took the blood sample. After seeing everything is safe and secure, this morning we checked her into our hospital and we performed her surgery. Right now, just 5 minutes ago, we completed the surgery. We transferred her to our recovery room. We are warming her up right now. Approximately 30 minutes later, she will be in her room. And if everything goes all right, tomorrow I'm going to transfer her to her hotel room again. During the procedure, before completing, I put one drain to my patient's tummy and the other one to her back. I'm planning to keep the drains for 4 days after the surgery. 2 days before she leaves Turkey, we are going to remove the drains. After transferring her to her hotel room, we will start doing lymphatic massages to her on daily manner in order to boost her skin retraction and make sure that her skin is completely smooth and flat. It is essential to perform lymphatic massages in daily manners. After being sure that her recovery is completed, early recovery is completed without any problem, we are going to give her fit to fly and we will farewell her to her country. Since this is a BBL surgery, it is important for her not to sit on her butt. However, in early hours, I'm not going to allow that because her well-being and safety is more important. So after BBL surgery, especially in the first 6 hours, she's going to lay on her back. 6 hours later, after her first mobilization, I'm going to switch her position and this time she is going to sleep in a butt-up position. The early recovery period and the late recovery period by nature require completely different care methods. So this is what I'm going to perform for her. If your flight is less than 5 hours, I like to keep my patients here around 5 days post-operatively, in total 7 days. But if your flight to Turkey is more than 5 hours, like maybe 7 hours, 10 hours, for example, if you are coming from US or if you are coming from Australia, I like to keep you here around 10 days. This is purely about your safety. As you know, the biggest problem after this surgery is clotting related complications, and the long duration of flights kind of contributes to that. In order to minimize that possibility and if possible diminish that possibility, I like to keep you here at least 5 to 7 days after my surgery. During your stay in Turkey, I am going to see you on daily basis. I prefer to check my patient on daily basis to see how their recovery is going and to be sure that their recovery is actually going without any problem. I like to prevent complications even before they develop. During your stay, every day we are going to see each other. My massage team and my nurse team will come and do your post-op care on daily basis again. Also, in the hotel you are staying, there is the nurse service 24/7. So you are going to have 3 layers of protection during your stay in Turkey. In order to perform a meticulous liposuction and BBL surgery, it is essential to use different cannulas because our body consists of different anatomical regions, and those different anatomical regions, different thickness of fat tissues, underlying soft tissues, vessels, even nerves. So it is important to have the knowledge of the anatomical features and to be able to use these instruments accordingly. In here, I'm going to demonstrate to you the most common cannulas I am using in my standard liposuction and BBL procedures. So this is my long 50 centimeter long cannula. With the help of this cannula, I am actually able to perform the liposuction with minimum number of entrance holes. For example, with your back, I can only open 2 incisions, like half centimeter long incisions. With this 50 centimeter long cannula, I am able to reach your upper backs, your armpits, even your sides. The second most commonly used cannula is this 20 centimeter long, 360 degree hold standard cannula. Maybe 50% of your liposuction procedure, I am using this cannula to be able to perform your liposuction and harvest your fat without damaging other tissues. This is an angulated cannula. I'm using this cannula to harvest the fat on your sides your love handles and your armpits. This cannula is a special one. This is something called the basket cannula. As you see, this is really wide. In revision cases, if there is a lot of scar tissues underneath, or if you have fibrosis, I am using this cannula to remove your fibrosis and remove your scar tissue which led to your revision surgery. This is a short cannula, just 10 centimeter long, and the holes are really small. I'm especially using this cannula for your thigh, outer and inner thigh area because the fat in your thigh is really soft, and I do not require an aggressive liposuction to be able to give you a smooth look. So this small cannula is the perfect choice for your thigh and arm liposuction. And finally, this is just an 8 centimeter cannula and 3 centimeter with 3 centimeter holes. I'm using this cannula for your neck liposuction. So this is quite tiny, and it is basically impossible to hurt or damage the underlying tissues in your neck region. And finally, for performing BBL, as you see, this is a 25 centimeter long and 1 centimeter wide holes fat injection cannula. It is really important to use this wide cannula while injecting fat, because this cannula is wider than all your vessels, your arteries, your veins. So when I use this cannula, it is impossible for me to inject the fat into your vessels. That is maybe the workhorse of a safe BBL surgery. Thank you very much. That was all for now.